today is March 9th, 2021, and we have an awesome learning time together here. That's so exciting. We are going to be learning about what is Social Security, Medicaid and TEFRA, and how they connect to the DDRC and the Medicaid waiver process, and how to apply for Social Security, Medicaid, and TEFRA. And at the end, we're going to wrap it up with our acronym book. We'll explain more about that later. But really excited. My name is Roberta Hovermail, and I am a DDRC navigator here at Stone Soup Group. And I'd also like to welcome Patty Freeman, who's going to be my co-presenter today. And Patty is a paralegal from Disability Law Center, and she has awesome experience with Social Security, and she's going to share it today. Patty, could you just maybe introduce yourself?
Well, you said it all.
Okay.
I'm Patty with Disability Law Center. I'm paralegal. Been doing this Social Security applications for about 6 or 7 years now. So I literally wrote the book on it too. So we have the how to apply for Social Security in Alaska, as well as this PowerPoint that I'm going to present today. Okay, so first off, so for applying for Social Security benefits, the first thing I want to say is I am not an attorney or a doctor. I have no way affiliated with Social Security at all. So all of this is just from trial and error for the last few years of doing actual applications online and in paper, actually. So first, to qualify for Social Security, you need to meet their definition of disability, and it's a pretty high standard, and you need to make sure that you have a disability and it keeps you from performing any work in the national economy. So it's a really high bar. They also have a listing of impairments. So you would have, if you say you had a developmental disability, you would still, just because you have that disability, it doesn't mean you meet their criteria. So you need to meet their criteria as well. So you can always go to the SSA listing of impairments if you needed to look at that. Let me move this out of the way. Here we go. So Social Security, there's 2 types of Social Security, and one is a needs-based, and that's SSI. So this is really important to know the difference. SSI is needs-based. So if you have kids, anybody who's not worked, or anybody who's not worked in over 10 years, basically, or worked 5 out of the last 10 years, may qualify for SSI. Both that you have to have a disability that keeps you from working in a job in the national economy. There's just the difference here. One is with the needs-based, you can only have a minimum of or a maximum of $2,000 for individual, $3,000 for a family or couple. Have no income, basically, and then things like retirement, stocks, bonds. It's all about resources and assets and income. So if you can have a home and a vehicle, and that's about it, is basically what it is. So SSDI is where you worked and you paid into the system. Now this is like all of us have paid into the system. You can go online and see how much you've paid in. I think everybody remembers getting that mailed to you. Now you can get it online at My Social Security. You can sign up your own account there, and you can see if you were found disabled today, how much you would get monthly if you were qualified for this. Like I said earlier, you have to work at a minimum of 5 out of the last 10 years, and it goes by quarters. So it gets a little confusing, but you can always look on there. If you go to ssa.gov and you look at your financial earnings history, and then you can pull down if you were to retire today. If you were to be found disabled today, it'll tell you if you earned enough quarters. All right, and so the applications are different. So for Social Security, for SSI, which I think that you guys will mostly be dealing with, if you're dealing with kids or people who have not worked. So basically, you just need to call the 800 number and tell them that you want to sign up for to get an SSI application appointment. So what's going to happen then is they will set up a time, and then somebody will call the person with a disability and go over all of their basic information and assets and things like that. We'll go into that a little bit. So the other way you can do it is just go to the SSA office, which obviously we can't do now with COVID, but once that's open, you can go there. The person with a disability has to go there to do that. And you can also file the paper application at ssa.gov. I don't recommend doing that just because they don't like it as much, which I'm not really sure what their problem is with that. But they prefer to do it over the phone with the person who knows what's going on. All right. And so what information you're going to need is basic personal information, where you're born, your name, obviously, social security number, things like that, mailing address. And then what's really important for the disability side, and this is for both applications, is to get all of the current hospital, clinics, medical, and psychiatric, anything that has to do with that disability, any medical professionals. And then if you're dealing with kids, you're going to make sure you want to get their IEP, any special ed records and things like that, the most current. Like if they're transitioning from school onto Social Security, you'll want to do that. You also need to know about the income and assets of the household. So if you live, and this is where it gets really, really complicated, but I'll just give you kind of a bit of an overview, is if you live, say the child is turning 18, but is still going to live with the parent's income will affect if the child will receive SSI. And it gets really choppy in there, and that's why it's best just to deal straight with them. That also includes assets, and assets are anything. I mean, it goes for like if you have a painting that you could sell, if you have burial expenses or like a burial plot or things like that. Stocks, bonds, CDs, anything. The PFD does count, the stimulus does count, and then like native dividends as well. And then so if you are dealing with somebody who is native, you'll want to submit the BIA. They'll want to do their BIA card because that'll keep out $2,000 of the yearly of their income. So that makes a difference when if an Alaska Native gets dividends and whatnot, it won't count against the SSI income. You'll also want to make sure that they have a letter from the corporation with all of their the number of the shares that are owned. And they usually, they're usually pretty easy. Just call it like Doyon or whatnot, and then they'll just fax over or mail you a letter or email you a letter saying how many they own, which is really helpful. They're actually have been really good about that. Now this, you don't need to worry about that part for SSDI. Okay, let's see here. Yep. So for SSDI, where you worked and paid into the system, this is where you're going to go online. And the first thing you have to do is you have to sign up for a My Social Security account. So that's where you can access your financial earnings, and you can see if how much you would get if you were retired at 62, at 65, or set full retirement at 70, and also if you're found too disabled to work today. And that is, they have some really crazy questions, and most people go, I don't know what you're talking about. For the security, it's very strange. So don't be scared about that. So for the information for the SSDI claim, it's the same thing, basic personal information, as in where you're born, mailing address, yada yada yada, things like that. This is where the difference is you don't have to list any of your assets or income or anything like this, because this is not based on need, like it's on a financial need. This is based on if you've paid into the system and if you're too disabled to work. So you will have to deal with your work history. They ask for, I believe it's the last 15 years worth of your work, which types of work you've done, if you were in a cannery or if you worked at a retail store, things like that. So they have basic information about that. and also your education. How far do you have a, do you have a degree in college, or do you have just, did you get a GED, things like that. And again, the most important thing is to list all of your hospitals, clinics, medical, psychiatric, anything, any medicals that pertain to your disability that's keeping you from working. You need to make sure that that is all listed. And then once the application online is completed, you'll print out a personal cover sheet, which it prompts you to do. And then you mail that. There's going to be an address on that, and you mail whatever medicals you've got to Social Security from there. And so then that gets that process started. Everything's just going now. Okay, so for both of the applications, you're going to receive a function report, actually 2 function reports and a work report. So the adult function report is going to be for the person who has a disability to fill out. So it's going to be about your ADLs, your activities of daily living. They want to know how your disability affects you on a day-to-day basis and keeps you from working. And so you have to think about, how hard it is to get out of bed in the morning. Like if you have depression, if your basic hygiene is not kept, things like that, if you're not able to do that. Also for the DD, if they're not able to, if they're not able to do simple 1, 2, 3 tasks, things like that, or if their memory issues, things like that. And it's a whole form. It's about 10 or 12 pages, and it walks you through activities that you would do all day. Like, do you do laundry? Are you able to brush your own hair? If you have physical issues, can you even lift your hands up to, put on a shirt, that type of thing. The other function report is a third-party function report. And this is for anybody who is close to the person with a disability. So like if it's for a child transitioning to an adult, it's probably going to be the parent, it could be a spouse, it could be a friend, it could be anybody that they know other than a medical professional. So what they're going to do, it's the same basic form. It's just how they observe that person with a disability and how their disabilities limit them in their day-to-day activities. And you can see I have a booklet that I think I mentioned earlier. I'm applying for SSDI in Alaska, and there's a sample in there. I even put kind of to give an idea of what that would look like. The next one is the work reports. So this is Social Security wants to know what you did for your prior work. So just because you can't do, say you were in construction, just because you can't do construction now because you broke your back, doesn't mean that you can't do a sedentary job, maybe working at a computer. So they want to know what your skills are and if you can transition into a different job. So like I said, it's any job in the national economy. So it's very broad. So what they're looking for is, what did you do? What was your title? What'd you do all day? And so, which is, I always find kind of hard to narrow it down because you do so many different things usually. But it's gonna be like, okay, I was on the computer doing reports for 3 hours a day on average, or I hauled lumber all day, and then it's gonna ask how long you've sat, standing, sitting, bending, walking, squatting, any physical activity that you did. They want to know how long you did it each day. And if you were a supervisor or a lead worker. All right, and then the other forms. So obviously you're not going to have that for SSI if the person did not work. Now, if you are working, say, if you're an advocate, I think you guys are navigators. I can't remember what you guys call it. But if you wanted to help a person do the application and you wanted to be their representative, you can. Anybody can be a representative. You don't have to be an attorney or anything like that. I'm a paralegal and I represent people all the time. What it does is basically it just gives you the power to talk to Social Security on their behalf and submit their documents and things like that. It's you're not going to go to court over it or anything like that. It's super simple to go ahead and just revoke it at any time. Um, and then also you can charge fees if you are the representative. And I can do the fees. You have to have a fee agreement in place, and Social Security has to approve it in order to actually charge fees. And nobody can charge more than 25% of the back pay only, with a maximum of $6,000. So what it is basically, if the person is denied, there's no fees. If the person is approved but there's no back pay, there's no fee. If they get a significant amount of back pay, it's just that one-time charge of 25% of whatever that back pay was. Like I said, maximum of $6,000, whatever is less. And then we can go to the timeline. So for both SSI and SSDI, once you have submitted the application for SSI, once you've made that phone call, that's going to be your protective filing date. So that's where that's your technically is your submittal. Once you've done your application online for SSDI, that's your submittal. So that's the time that it actually starts. Then it goes to Social Security. And so it goes to Social Security for the non-disability review. The non-medical review. So is basically where they're just looking, did you pay into the system? What are your assets and resources and things like that? That kind of technical stuff. Then it goes over to the DDS, which is the Disability Determination Services. This is when you can actually talk to an actual person, which is nice. It's kind of when it goes to Social Security, it just kind of goes into the void. DDS is where they're going to collect all the medical records. Anybody that you had listed on your application, they will contact and get those medical records. They review them. They send you out the function reports and the work reports. And this is the time that if you can't get that stuff done, there are deadlines. You can call them and say, hey, it's going to be a little late or whatnot. So once they get all the function report and all the medical reports, they do their review, and then it goes out for federal review, which it doesn't take very long, I think like a week or two, but I'm not positive. And then it comes back to Social Security for the final decision. And this is a good 6 to 8 months process. This is not anything that's going to happen overnight by any means. So if you are awarded SSI, not SSDI, you need to make sure that any changes in circumstances, if you change your home, you have a roommate move in even, or you got married, you got a job, or you got an inheritance, maybe your native dividend was higher than normal, that type of thing, you need to make sure you talk to Social Security about any changes, because you don't want to get kicked off. You don't have to worry about that for SSDI though. So if you are denied after all of that, you have 60 days to file for reconsideration. And reconsideration is basically going back to the DDS, and it just goes to a different person and a different doctor oversees it. So it's almost the same as doing this application again, but at that point you can always add in more. Say you got a psych eval, or maybe you got in an accident, so there's something else different, another disability, something like that. So this is where you can actually turn in new information. You can always reapply as well, as long as you have new medical information, or you can accept the denial. I think we were talking about what happens after this, and I don't have slides for this, but if you get denied after reconsideration, then you can you can appeal to an administrative law judge, and you'll have a hearing. That's when you probably want to get counsel, or at least somebody to represent you. And disability law center has referrals. We don't do those anymore as much. We do occasionally, but that's when you're going to want to call us, and we can give you the referral list for people that help represent at that point. Then if you get denied at the hearing level, you can go to the appeals council, and then the appeals council goes to federal court. So that all is years in making right there too. So So I don't, but it's up to you if you want to. You can always reapply, like I said, if you have new information. So the resources, if you're interested in learning more about SSI, I would try the SOAR training, which is really comprehensive, but it is free and it's online, and you can go at your own pace. You can always go to Disability Law Center, our publications, which is, well, there's a full list, but it has the how to apply for SSDI in Alaska, and it's got all the forms, and it's step by step on an actual application that I went through and just filled everything in. Then you can always go to ssa.gov or call them. And then if you go to Disability Secrets, I always find if I have kind of a weird question that comes up, I just plug it into there, and there's usually some answer of some sort that gives you more of an idea of what's going on.
I have a question.
Yes.
How likely is it to get a denial at first, even if you have substantial, like a diagnosis on paper from a child psychiatrist or your psychiatrist?
A diagnosis is not going to get you Social Security. It has to be more of the, like you have a full psych eval, that type of thing. And it's going to be about how limiting your mental health is to working in a work environment. Our Social Security, our DDS here in Alaska has one of the higher approval ratings in the nation. I think it's at 52%. That's which is pretty good. The appeals is where we really have been lacking at like 19%, I believe is what it is. So it's really important to get as much information from your psychiatrist, medical doctor, whatnot, to really give them a good source of records to really get into it and see how your disability really is affecting you and how it's keeping you from working. So that's, and having the mental health side is kind of difficult, but it's always good to make sure, like if you had any API admits, any ER visits, things like that, just to make sure everything is incorporated with that.
Okay, thank you. Is it possible to work and collect SSI for a child with special needs, like a child who has autism and ADHD?
Yes. Yeah, like as a parent working, yes.
Yes, yes.
It's just that income is going to be what is factored into if that child is eligible. And I don't know enough about SSI for kids to tell you exactly what those limits are, but you could probably just go on ssa.gov and see applying for a child, because they'll have all the regulations on there.
Thank you.
Well, thank you, Patty, so much. So enjoyed that. And it was a really clear-cut presentation for dealing with Social Security. Thank you so much. Patty is a wonderful resource, and we thank her for coming here today and sharing with that. And like she said, she is not an attorney. She has no ties to Social Security, but she is sharing personal information that she has gathered, and it's a great resource. So thank you so much. And
Yes.
she did write the book.
I did literally.
Yeah.
So yeah, and if you have any questions about SSDI, is again more of my specialty than SSI. I'd be happy to answer any questions if you just call me at the Disability Law Center, or if you need referrals to somebody who needs to help. And I actually do represent at the application level for SSDI. So if you have somebody who's really struggling and needs help to get through that, send them my way. They'll go through our intake process like normal, but even if you do send them, but I'd be happy to at least look into their case.
Well, thank you, Patty. Thank you
All
so
right.
very much. So now we're going to head into the next PowerPoint presentation about Alaska Medicaid. So what is Alaska Medicaid? Alaska Medicaid is an entitlement program that assists Alaskan individuals and families with healthcare coverage. It is jointly funded by federal and state governments. The Division of Public Assistance, otherwise known as DPA, is responsible for determining the eligibility of individuals and families in need of Medicaid benefits. For Alaska Medicaid, the categories include Medicaid expansion, family Medicaid, breast and cervical cancer, Denali Kid Care, under 21 Medicaid, adult or public assistance related Medicaid, nursing home Medicaid, home and community-based waivers, and TEFRA. Each category has unique eligibility rules and guidelines. You need to be enrolled in Medicaid if you are polled for a home and community services-based waiver. Even if someone has benefits through their native corporation, they need to have Medicaid in place when polled for the waiver waitlist. How can I apply for Medicaid? Well, you can apply now one of several ways. One is go to www.healthcare.gov to apply for a healthcare plan or Medicaid through the federal marketplace. Or you can go to www.my.alaska.gov to do an online application through the Division of Public Assistance self-service portal. And then the third way is to download an application, and the application that you'd use is called a Gen 50C form for Medicaid, and mail it in or drop it off at a public assistance office. Applying online. So you can go to www.myalaska.gov, which you'll recognize as the same place that we go to also apply for our PFDs. And you can do an online publication through the Division of Public Assistance self-service portal. When you get to myalaska.gov, once you sign in, you will come to a page that looks like this. And alphabetically, you will go down to where it says Aries Public Assistance. You'll click on that. And right there, once you click on that, and you will be directed to the Aries self-service portal. And you can do a screener on there to see if you qualify income-wise. You could also start an application. You can save an application and come back to it later. And then also you can view details about your case. Now there's also the Department of Public Assistance has a great Medicaid electronic application walkthrough video. And it's about a 12.5-minute video, is a walkthrough on how to fill out an electronic Medicaid application for children under 21, pregnant women, and parents or caretakers of children under 18. Adults between ages 19 to 64 who are not receiving Medicare and may be eligible under Medicaid expansion can also apply for Medicaid online. Let's say you want to do a paper application. Download the application from this website. And like I said, it's for the Gen 50C form. Print it out, complete it, and mail it or drop it off at your local public assistance office. If you do not have access to a computer or a printer, you can get a paper copy from the lobby of your local DPA office, public library, public health nurse, or ADRC or DDRC navigators. And Stone Sioux Group, we do have DDRC navigators. So you're welcome to come and you're welcome to call us and we can help you with that. If you need to use a computer to download an application, that's something that you can, the libraries are now open within the Anchorage area, and you could check their websites for their times, but that is another way to also do it online, but maybe you could do it at the library's computers if you do not have one at home. Okay, this is a listing of the Division of Public Assistance offices statewide. And I just want to note we have all the districts here represented. And to note that the Anchorage District office, where it once was 3 separate offices, it was at Gamble, Muldoon, and then C Street for long-term care. They're now going to be in one, and it's going to be a district office at 3901 Old Seward Highway. And the Gamble, Muldoon, and C Street offices will merge to one location in Midtown Anchorage at the University Center Mall, beginning in mid-March 2021. The interior lobby at the new office will be used to pick up and drop off information during regular business hours, Monday to Friday from 8 a.m. to 5 p.m. Notice, while offices are not providing in-person service at this time due to the COVID-19 public health emergency, lobbies are open to pick up and drop off information and applications. Drop boxes are supposed to be checked daily. Email and voicemail messages are supposed to be responded to within 2 business days. If you have not received a response within 2 business days or 48 hours, please contact HSSD PA Director Office at alaska.gov. The business hours are weekdays from 8 a.m. to 5 p.m. Interviews are conducted telephonically Monday through Friday from 8 a.m. to 3 p.m. Okay, and here we are with the Gen 50C form. So with this application for services, I want to point out first that they let you know that it may take a place to process your application. And that's something that is important to know, because sometimes we're waiting for something, it seems longer than what it should be taking, but we need to keep in mind that there are people looking at these and they need time to look at all your information to make a determination. Also, under programs, see to the right in that gray box where the highlighted Medicaid is, that Medicaid offers medical coverage to low-income individuals, people over 65, disabled, blind, pregnant women, and families with dependent children. Also helps with Medicare Parts A and B premiums. And to the left, where it's highlighted with what you may need to apply for health insurance, it gives some information about some of the things you're going to need to have information in order to complete your form. This is just an information page. They want you to read this and then keep it for your records. The next page, what you may need to give us. Again, this is another information page. It goes over what you need for identity. Then it goes over residency, earned income, unearned income, and then also some other documents which may be required. If there is guardianship papers, legal conservator papers, power of attorney papers, or a supported decision-making agreement papers, that should be included, a copy of that with your application. Okay, so now we're on to, actually, this is really the application. The first 2 were just information pages. And before I go further, I would just like to say, whether you do an application, paper application, or you do it online, make a copy of your application before you submit it. It's important to have, because in case a question comes up, you'll know exactly how you answered, and you'll have your written information down so you can respond. And then if you needed to reapply, you will easily have that information available to do that. Now, on the first page of this application, you'll see where I highlighted where it says Medicaid, Denali Care, and Denali Kid Care. Those 6 boxes over there, actually there's 7. This form is used for a variety of different services. For whatever services you'd like to see if you can be eligible for it, you're welcome to check off. But be mindful that every time you check off something, that's going to take longer for them to go through each of those categories. If you're just looking to do for medical health insurance, then just check the top box that's highlighted, Medicaid, Denali Care, and Denali Kid Care. Otherwise, if you go through the other ones, you're more than welcome to check them off, but please note that it will delay your application. So if you're just looking for health insurance, just check the Medicaid box at the top. Okay, so the first part is that people in your household, you want to complete for each person in your household. This page is for you or whoever is the person who's filling out the application. So one of the things is, it talks on, it has your name, social security number, and then for question 24, it says, do you plan to file a federal income tax return next year? You can apply for health insurance even if you don't file a tax return. And some people, for various reasons, they maybe So you would need, they're talking about next year. They're not talking about filing for this year, but for next year. Then on question 26, it says, do you need public assistance services for yourself? Even if you have insurance, there might be a program with better coverage or lower cost. So this is where, when I explained to you that this form can be used for applying for other services as well. If you're not going to apply for those other services, and this is just to apply for the health insurance, then just check off no, and then you could skip the other questions. And on question 30, I did want to bring that up. Sometimes they do make it available that they will ask you, do you have previous medical bills that you want to be considered for Medicaid to take care of? And it can go back at least 3 months. Sometimes people have hospital bills. If that is something that you'd like to do, then you can check that off, but you will be having to provide more information. The next page is for the next person in your household. So I just wanted to show you that. So you're going to have to go through all those same questions again. And then it goes on to another page for the other individual, and you can fill out one for each individual in your home. So there is income in your household. This is only if there is a job, and a job that where you're making a competitive wage. So this is where you have a job, you're getting paid for it. It's not an internship where you're putting this down. This is for an actual job. You get a pay stub for. Okay. This next page, please answer the following questions about income. So please note on item number 95, it says, for self-employed household members, please answer the following questions. That's only for somebody who's self-employed or their own contractor. Okay. Then it'll talk, we have highlighted, oh, no, well, I need to go back, please, to that last one. Thank you. Okay. As you go down, there's another question where it says 96, in the past 2 months, did anyone in the household, they want to know, did they change jobs or so forth. And then 97, other income. And then it says check all that apply. But I want you to note something. For health insurance only applications, you don't need to tell, and it says right there, to tell us about child support, veterans payments, or supplemental security income. But something you do need to put in the box down below is where I highlighted individual name and the state of Alaska PFD. And so you do need to record that there. Okay. Then let's see, yearly income. That's only if income listed changes from month to month. And then in question 100, it says, does any person applying for health insurance or public assistance services expect any changes in any of their income or employment? New income or employment not provided. Okay, so that's just if they're applying for the health insurance. And then step 4 is if you are Alaska Native or American Indian family members, answer those questions. Then step 5 is your family's health coverage. This is only if someone in the family has health coverage through their employer. And they may have health coverage through their employer, and that's okay. You can have health coverage through your employer and also have Medicaid, but you do have to meet eligibility income guidelines. So this is where you'd put that information. And step 6, it says, skip step 7 if you are only applying for MAGI, Medicaid benefits. You must complete step 7 if you're applying for disability-related Medicaid or any other public assistance program. With MAGI, some people call it MAGI, some people call it MAGI. It's the modified adjusted gross income. The Internal Revenue Services calculation of income and household size. MAGI will be used to determine eligibility for health insurance programs, including Medicaid and Denali Kid Care, as well as premium cost sharing assistance for tax credits provided to low and moderate income individuals under the Affordable Care Act. So there's types of Medicaid. One is the MAGI, Modified Adjusted Gross Income Medicaid, for parents, caretakers. Sometimes you'll hear the word expansion Medicaid, or for expansion adults, and that's adults between 19 and 64 years of age who are not receiving Medicare and may be eligible under Medicaid expansion. They can also apply for Medicaid. And then children under 19 without insurance. And then, and then pregnant women. And then we go on to the next page, which is a release of information that has to be signed. Next one is, this is a new page actually, where they're going over some statements that you will need to initial next to, which I have also highlighted, and then the adult applicants have to sign this as well. Okay, and then 10 is contact people and organizations. So why would you need to complete this form? To determine your eligibility for assistance. So this is for if somebody was applying for other assistance programs, such as SNAP or rent assistance or for utility assistance, that they may need to have information from your landlord or someone else that can provide them information to Department of Public Assistance to make their eligibility determination. Appendix A is if you do have health coverage from employment, this is where you would put in some of that information. And then the next page is a worksheet that helps you get that information, to put it together. You may need to talk to if somebody does have job-based health insurance, then they would need to talk to their HR person, and they may need to get some more information to put on this form. And with the Medicaid application, you can also register to vote. And so you can do this here. They make it easier for people that they can do that, almost like one-stop shopping. The next page is actually Appendix C. It's appointing an authorized representative, which is optional. You can have somebody to represent you on all matters related to your application in case. The thing is that they can talk with DPA can talk with them. Maybe it's a parent who's doing it, helping their adult child. Maybe it's for a sibling that may need to have some support in that area, or somebody just wants some extra support and somebody else to be a part of it. They do not have to be a legal representative. They are not going to, there's only certain things that can be done. The person, one of the things is you can appoint, withdraw, or change an authorized representative at any time. And if you have a legally appointed representative, somebody like a guardian or a power of attorney or a legal conservator, you would send the paperwork in and you would not need to complete that part of that section. And then Appendix D is child support information. That's only if you're going for more assistance. And then, sorry, this is the voter registration. And then on the back of the application is listed all the public assistance offices and their contact information. And coming soon, future changes at Department of Public Assistance is, which I think is pretty exciting, the division is looking to expand working hours from 7 a.m. to 7 p.m. and to include Saturdays in the near future. This change will also allow for an expanded time frame to schedule required interviews, and those are those telephonic interviews, beyond 8 a.m. to 3 p.m. The division plans to launch a single virtual contact center in April 2021, so next month, that will alleviate the need to contact an office directly, as cases are handled statewide and scheduled for processing in date order. The division recently launched a new single statewide email address for all offices at this email address, which will further help with workflow. The division processes cases statewide and tries to resolve all inquiries on first contact. They will continue to address any questions you may have about the move and post them to their website at this address, and they look forward to serving you from their new location and statewide. And regardless of which Medicaid program you participate in, to keep your benefits current, complete and return your renewal application, which is a yellow form that they will send you, or you can pick up at the DPA office as well by the requested date. If you turn in your renewal application on time and you're found eligible to continue receiving benefits, there will be no gap in your coverage. And I can't strongly emphasize enough, please complete and return your renewal application. It's very important so that you don't have a gap in coverage. And then there is an Alaska Medicaid recipient information helpline. It's 800-770-5650, option 2. So if you're a recipient or a recipient advocate and have questions about Medicaid coverage, please call this number, toll-free statewide, Monday through Friday, between 8 a.m. to 5 p.m. Alaska time. That's important to note. After hours, please leave a message and your call will be returned the following business day. You can also email the helpline staff at memberhelp@conduit.com. And the recipient services representative will assist you with your questions about services covered by Alaska Medicaid, provide a list of Medicaid enrolled providers, and explain how to use your Medicaid benefits in general. Another great resource is the Medicaid Recipient Handbook. The purpose of this handbook is to help you understand available programs and, if you are eligible, how to effectively use the coverage. This handbook is not designed to provide detailed and individual information, but instead to offer a broad overview of the program and services available. And you can get this Medicaid Recipient Handbook online at this address. The Medicaid Recipient Handbook, I really like it because it's a great book to go back to, a good resource. And there are things in there where they will tell you if you wanted to do non-emergency transportation, if you wanted to, for example, be able to go to a therapy visit or a doctor visit and you did not have transportation, then how you can call and arrange for that and what is considered that you can do and what you can't do. And that's an important thing to know about any type of service you access. What is available in reality and what you can do, not just what you think they should do, but you should know what they can do. It makes a big difference and it really will cut down on frustration. And I just wanted to touch on TEFRA, which is the Tax Equity and Fiscal Responsibility Act of 1982. TEFRA is a Medicaid program that was developed with specialized requirements that may allow children who would not typically qualify for Medicaid because of family income to receive specific Medicaid benefits. The child needs to meet the medical, developmental, or psychiatric condition that fits the supplemental security income definition of disability. Only the child's personal income and resources are used when determining eligibility, not the parents. Not all children who are determined disabled or have high medical costs qualify for this program. A family has to apply for Medicaid and be denied due to parents' income by DPA before the parent can apply for TEFRA Medicaid for the child. The age limit for TEFRA Medicaid is set at 19 years of age. However, it is expected that at age 18, a TEFRA child or child's parent should apply for supplemental security income and move to adult public assistance and related Medicaid prior to turning 19 years of age. Denali Kid Care and TEFRA Medicaid provide the same Medicaid health care coverage for a child. A TEFRA care coordinator can assist with the initial process of applying for TEFRA as well as the annual application. And there is a listing of care coordinators at the Senior and Disabilities website that you can access. And if you need more information on that, the DDRC navigators at Stone Soup Group would be more than happy to help you. Here's our contact information. Thank you so much for being a part of these presentations for today's Lunch and Learn. We really appreciate it. Before we close out, I wanted to turn it over. I told you earlier in the beginning of our presentation that we were going to have for the DDRC alphabet book, and Dan Gallagher is going to present it. And this is an exciting thing to have, a wonderful resource. So Dan, if you'd like to do that, we'd appreciate to hear more.
Okay, so we're putting together this alphabet book to try and help individuals out as they go through different processes as far as the waiver process that we can help out with, and then any other things that we come across along the way. And so the first one was the eligibility application. The second Lunch and Learn that we did was the DDRR application. And then today's was the Social Security and Division of Public Assistance. And so if we just scroll down here, we have common acronyms that we come across in each of these phases. Some note sections in case you pick up anything else or want to take any notes. And then we have our acronyms from today that we may come across more readily with Social Security, Division of Public Assistance. And then if there's, excuse me, if there's any other acronyms that you're coming across that you're not seeing in any of these sections, we have the space here to take note there. And then if, by all means, I'm usually one of those people that is like a squeaky wheel, no filter. So if I'm in the middle of a discussion with somebody and they use an acronym that I'm unaware of, I might stop them real quick and just say, hey, what does that stand for? Remind me again what we use that one for. And then I'll just take notes of it right here or off to the side. And then if you don't feel comfortable doing that, or it doesn't feel like you have the time for that kind of thing, jot down whatever you can, and then you can reach out to any of us, especially if you're working with any of us one-on-one, and we can help you figure out what the acronym means and sort of best examples to try and help explain it more if needed.
Well, thank you, Jan. That was excellent. And so those are always needed things. Sometimes I have to catch myself when I'm talking that you just kind of get in the moment and then you're talking about things and you have all these acronyms kind of spewing out of your mouth. And we need to kind of take a step back and think, wait a second. Sometimes it's important to say, instead of DPA or SSG, say, Department of Public Assistance, Stone Soup Group, because not everybody may know what you're saying. And acronyms kind of take on a whole different category of themselves. So wanted to thank everybody for coming today. Thank you so much for your time.